absolutely. Absolutely. And, I think the other thing that obviously leads to so much problems is people feeling like there's gaslighting or other things that have happened in the medical community where they're not being believed or understood. And I think one of the other things, and I imagine you see this in a lot of your work too, which is that diagnostic, say, label being the endpoint for people. And I think so many times people get like the fibromyalgia diagnosis, the migraine diagnosis, the chronic fatigue, all these types of diagnosis, whether they're a conglomeration of symptoms like a syndrome or a true diagnostic. And it's like the endpoints, right? Versus like that listening is to actually go back and say, okay, well, what is like the diagnostics and should in many ways, like the label we give should in many ways be like that beginning point. So when we're listening and it's say somebody that you have in your clinic and all of a sudden it's like we're talking about, wow, this doesn't make sense. That's what you're listening for, is like, does this make sense, does this not, is there a clear path to, oh yeah, I got this implant, or I did this thing, or I had this trauma, and we can see the path. Or it just seemed like everything got muddled and tangled, and when everything is muddled and it doesn't seem clear, that is usually when one of these chronic inflammatory things does come into play.
Yeah, it happened to me when I was interviewing a patient who didn't have breast implants. And they were just talking and wanted some advice about their body contouring and a no cut facelift, which we do, and all these different things.